causes of maternal death.
Nobody from the RH department.
Yeah, RH department's not allowed to speak. Anybody else? Postpartum hemorrhage. Good. Anything else?
Stephen's fire department, right?
Sorry?
Stephen's fire department, yes.
No, Stephen is not allowed to speak. Anything else? Postpartum hemorrhage. That's correct. That's the leading cause. Any others? Any others?
I guess you could have unsafe abortion.
Unsafe abortion. That's right. That's the second or third leading cause.
Infection after delivery.
Infection after delivery. Exactly. That's one of the top three. Any others? Okay, RH department. Yes, there we go. Preeclampsia and eclampsia is among the top four.
Sorry, what was that again?
Eclampsia and preeclampsia. I'll talk about what that is in a minute. And the last one is obstetric labor, that's among the top five. So about a quarter is caused by postpartum hemorrhage of all deaths. Infections is 15%, eclampsia and preeclampsia is 12%, obstructed labor, when the head of the baby is too large to fit through, 8%. Unsafe abortions is very significant. These are complications from abortions that women get in countries where safe abortions are either not legal or not available. So let me talk a little bit about postpartum hemorrhage. It's excessive bleeding after delivery was caused by the uterus not contracting, and so women bleed and bleed and bleed, and they bleed to death if they're not treated. It occurs in 10% of all births, and there's not a lot of accurate predictive factors in postpartum hemorrhage, so that means it's really incredibly important to have treatment available or to use prevention for preventing the bleeding from happening. The gold standard for prevention is use of oxytocin. It's an injectable drug. Active management of third stage labor is just the administration of this drug right after delivery so that the uterus contracts and the bleeding is stopped. The oxytocin is also the gold standard for treatment, so it can be used for the prevention of bleeding, and also if it's not given for prevention and the bleeding starts, oxytocin is also administered as the best treatment, well, the gold standard from WHO standpoint for treating hemorrhaging. The limitations of oxytocin are it requires cold storage, so a lot of more remote health facilities have problems either keeping it in the right temperature or having the right potency because it's either been exposed to heat. There's distribution chain limitations also, so a lot of the rural health facilities don't have the oxytocin at all, so we'll talk about how we can help with that. Preeclampsia, it's excessively high blood pressure during pregnancy, and it leads to seizures, which can lead to death in women. It's diagnosed by high blood pressure and excessive urine protein in the urine. And the causes of it aren't very well known, but it can be identified with blood pressure tests and urine tests during antenatal visits. How's it prevented? Treated? It's treated with magnesium sulfate, which is a drug that's injectable, injected, intramuscular injection, and it prevents seizures. Actually, I think that was it was pointed out that it doesn't actually treat seizures; it prevents the seizures from happening. And then, if preeclampsia gets severe or eclampsia sets in, the only way to treat it beyond the magnesium sulfate is to deliver the baby. There's no proven effective prevention for it, but there have been some trials done on calcium supplementation and aspirin, but they haven't been really proven to be very effective. Can anybody tell me other factors that play a role in safety of childbirth and delivery? What else would impact safe delivery, health of the mother and the baby, if you're thinking about a developing country?
Deliveries at home.
Deliveries at home, access to health facilities and skilled birth attendants. Anything else? Women living in rural areas, transportation problem, education, knowing where to go. Antenatal care has been shown to be very effective. The higher the antenatal care in countries usually have lower rates of maternal mortality. Women can be tested for high blood pressure, protein in the urine can be tested for. Women can be counseled about birth preparedness. So overall, 4 antenatal visits are recommended. Low-skilled birth attendants. Most women in developing countries are delivering at home with unskilled birth attendants, such as traditional birth attendants who have never been formally trained, or a relative, mother, aunt. Access to essential medicines and equipment are not available in a lot of developing countries, particularly out in the more rural areas. Distances to health facilities is a huge barrier for women, particularly in rural areas. And then let's talk for a moment about 3 delays that contribute towards maternal death when it comes to delivery. Does anybody know, has anybody heard of the 3 delays? Raleigh, were you raising your hand?
Yeah, but
Right.
it depends what department I'm in today.
I'm down in line.
Since nobody from outside the department is raising their hand, please go ahead.
The first delay would be delay in going to the